I'd like to welcome you to the 7th in a series of webinars on age-friendly environments. Today's webinar is called Social Inclusion and the Design of Age-Friendly Spaces and will be presented by Dr. Ryan Woolrych. Dr. Woolrych is an Associate Professor in Urban Studies at Heriot Watt University and an Adjunct Professor at the Gerontology Research Centre, Fraser University, Canada. He has significant expertise of working on funded research in the UK and internationally, exploring the experiences of home and housing in old age, evaluating the impact of communities services for older adults, and in applying visual and participatory methodologies to understanding the relationship between older adults and place. Dr. Woolrych has published widely in housing and community journals. He is project lead on a 3-year economic and social research grant entitled Placemaking with Older Adults Towards Age-Friendly Communities and co-investigator on 2 funded international research projects bringing together local government, community groups, residents, and practitioners in processes of collaborative planning and social change around healthy and active aging. On behalf of the IFA, I would like to thank Dr. Woolrych for presenting today. The IFA invites all participants to participate in questions after the presentation. We'd like to invite you to do that via the questions tab. If you have any questions, please feel free to message me. I am the organizer, and I invite you to send your questions via email if they're not answered during the webinar. With that, I'd like to turn it over to Dr. Woolrych, so thank you all for attending.
Thank you, Jessica, for the introduction, and I would just like to start off by saying thank you for the opportunity today to come and present some of my research and talk about some of the things that we've been doing internationally in this area. Jessica, should I just move that off the screen?
Sorry?
Can you see my?
I can see
my
sort
presentation
of.
okay there?
Yeah, if you do from current slide, it should get big, and then you should be good.
Okay. You can see that okay?
Yes.
Perfect. So today, I'd like to take the opportunity to talk about social inclusion and exclusion and its impact within the context of urbanization and aging. People tend to ask me why I focus on urban areas and what I mean by urban. I mean anything non-rural. In the urban context, this includes cities, but also suburban neighborhoods. And it's not to say that rural areas are not important places to focus on in respect of aging, and they bring all their unique challenges. And some of the findings, I think, do translate across to rural communities. But my research focus has been on urban areas and cities and urban neighborhoods. And today I'd like to discuss some of the opportunities and challenges in respect of social inclusion and urban areas. And at the end, maybe have the opportunity to pick up on some of these issues and maybe other people's experiences as well. I understand that the policy context in the UK will be very different to other jurisdictions. I'm not presenting much about policy today, but to say that social exclusion and inclusion is right back on the agenda in the UK, stimulated in part by an Age UK ILC report asking the question about if social inclusion was still important for older people today. And the concept, in part, that was a response to the fact that the concept have virtually disappeared from national policy in the UK, being associated with previous Labour governments and the disbanding of a social exclusion unit in the UK. So although it's very much still on the agenda in European and UN policy, and it's starting now to gain more traction in the UK context, largely on the back of studies such as the English longitudinal study of aging, which have identified that older adults, particularly those who are frail and experiencing cognitive decline, and also particularly those living in deprived communities, are more likely to experience multiple forms of social exclusion. And keeping older people, everybody knows, independent and autonomous can be regarded in two ways. Partly that it's a societal obligation, a moral and human rights perspective, to make sure people and certain groups are not excluded from social relationships and civic activities and access to information and cultural activities. And similarly, prolonged independence in old age can also have fiscal and financial benefits. So it can be argued from an economic perspective about the fact that, if people are socially included and they are active and they can stay healthier for longer, this does have health and social care benefits. So it's a debate that's currently happening quite strongly now in the context of the UK, particularly in terms of funding the National Health Service. Some of the findings that I will present back as part of this presentation are ones that have been emerging from as Jessica mentioned, a grant that I am currently lead on. It's a cross-national proposal. It's funded by the Economic and Social Research Council in the UK, and it's very much focused on understanding how older people experience aging across different urban, social, and cultural contexts. So we're working, and it's a collaboration with Brazil around how we can, what we can understand about older adults' experiences across different contexts, and also what the implications of that are for the design of age-friendly cities and communities. And if you want to find out more later on, there's a website and a Twitter handle as well if you are interested in finding out more. I think it's important to say that population aging and urbanization, having different ways become quite dominant social trends, and they've raised issues for all types of communities. And in some ways, and in some countries, this has occurred against a backdrop of rapid urban change, the rise of the smart city movement, megacities, and other large, highly dense and heterogeneous cities in some cases. However, it's important to note that in other parts of the world, cities have also undergone significant depopulation. This has happened particularly in a UK context, for example, brought on by deindustrialization and significant underinvestment in our cities, which have hollowed out the urban core. And I think it's one thing that I don't think is particularly recognized, partly because we don't have the case study evidence for it, is how experiences of aging are likely to differ significantly across those urban contexts. And to some people, urban living can bring significant opportunities, close proximity to transport, services, amenities, employment opportunities, and cultural support, which can all form parts of social inclusion. But also urban living can bring many threats in terms of access to good housing, lack of basic services, spatial and inequality and social polarization. And these things can actually reinforce social exclusion. So there's these type of processes and opportunities and threats that urban areas can have. Why older people? I think older adults particularly are likely to be impacted by sudden changes to the immediate environment. So in old age, particularly with cognitive decline and frailty, they're more likely to focus on that immediate proximity around home. And so any changes to that can ultimately impact them as much, if not more, than other groups. Secondly, I think there's an urban movement which has been focused on how we can design cities with economic factors and urban areas with economic factors in mind, predicated largely on how much money we can bring into a city, rather than creating a city as a dwelling space, i.e. a city that people want to spend time in. And I know a number of studies which have looked at old age in the context of urban environments have found that often older adults feel disconnected, alienated from the city, and excluded from urban areas. And we've seen that within the context of the research that we're doing, which is that often older adults who are living in a high-rise tenement block in the centre of Glasgow, for example, with no lift and no social supports, can be excluded as anybody else. So I think there are disproportionate impacts as well in terms of our inequalities, which again are poorly understood, in terms of how older people, for example, living in slums and shanty towns. So cities should be seen, obviously, as an aesthetic and technical challenge in terms of how we design these age-friendly supports, but also, socially, how cities can reinforce inequalities, exclusion, and marginalisation, and likewise, how that can impact on older adults. And why this is particularly relevant in the context of our work in Brazil is that people, communities, societies are aging at different rates. And some of the discussions we've been having in Brazil are about the rapidly aging population over there, considering that Western Europe, certainly the UK, has had a number of years to respond to an aging population, but that's likely to happen faster in countries such as Brazil. And do we need new theories or models of aging that will respond to some of these issues? And about priority needs, and some of our lower income communities in Brazil, the research that we've been doing, has often commented on the difficulties in accessing just basic necessities, clean water, utilities, and basic services. And so the discussion has been slightly different in that context. And also, we recognized very early on in the research that we were doing that Western solutions are not necessarily going to fit the social, political, and also the cultural structure in some of these countries. And so do places, what do these models look like, and do places need to respond to these different forms of urban change and political buy-in as well. Social exclusion, sometimes see this as sort of the opposite of, social inclusion, in terms of what social exclusion brings. And I know some of the very early definitions of social exclusion focused on the importance and centrality of income. And I know income is extremely important, and I wouldn't want to sort of undermine the importance of income, because without, inability to pay household bills and difficulties in social participation and leisure opportunities, and money does constrain those forms of engagement. But also, I think this definition recognizes that actually, it's also about these different sort of multiple forms of disadvantage, and it's as much about the relational stuff in terms of social participation and lack of social integration, and also issues of power. And central to this is, I think that this debate is how we create opportunities for social participation for older adults, such that they do feel socially included. And this isn't only having the opportunities to be engaged, but it's having the resources to take advantage of these opportunities. So I don't think it's any good having leisure opportunities, for example, if there are no means for connecting older people to them. Similarly, opportunities to participate and make a positive contribution, they're integral to notions of freedom and autonomy. And I suppose there are a few issues with a definition of social exclusion. First and foremost, it tends to frame everything as quite negatively, forms of social exclusion. Should we be framing it more positively and talking about social connections, community cohesion, and building a more just society as part of a social inclusive framework? And maybe we need to closely consider the importance of diversity in this issue. For example, the role of age, gender, ethnicity, which hasn't quite been articulated in the age-friendly communities agenda. This is also driven by the notion, and a key policy driver in many countries is about how we support aging in place. Aging in place, assuming that the home and the community is the preferred environment within which people want to age. It's generally where people feel comfortable making decisions. They feel a strong sense of independence. Equally, the home can have some symbolic, emotional, psychological value to the older adult. However, we've noticed this in the research that we're doing, is that often the home can quite quickly become a very vulnerable, social isolating environment without those supports being in place. So often you find that these sort of notions of home change across the life course, and particularly in old age when there are difficulties with activities of daily living that can be brought about. And so Gallant, Stephen Gallant, talked about in some of this literature about aging in the right place, that it's about actually not just aging in place, but aging in a place where people do have access to assets and resources, and are living in a community of choice. And this is very much about seeing older adults as a resource. And particularly in the UK, but also in terms of some of the academic literature, it's tended to look at old age as a sign of weakness, deterioration, and that's not been particularly helpful to certainly even speaking to older adults at a community level about them variously being seen or feel they are a burden, a drain on the pension system. This is common in the UK, where we see very negative headlines, and where older adults are blamed often for the demise of health and social care services, and often being an excessive burden. And again, within the context of the UK, these discussions are had with the National Health Service and how we continue to fund the National Health Service. And this is filtered down to intergenerational tension at a local level as well, and more recent politically as well with the Brexit vote, where the blame seemed to lie squarely with older voters. And so there's this very damaging sort of rhetoric around old age and what it means, and being seen as a burden as opposed to seeing it as an opportunity. And either way we look at this, I think we're talking about two sides of the same coin. An environment that is conducive, to active aging will have benefits in terms of health, which will in turn, reduce health and social care costs. So I think it's, whilst the headlines in the media have been quite negative around this notion of the aging population, I think if we see it as an opportunity, it essentially addresses that debate anyway. I think what's quite alarming from data in the UK has been this disparity between life expectancy and healthy life expectancy. So whilst life expectancies continue to increase, so slowed down slightly recently in the UK, healthy life expectancy has not closed the gap. So what we're finding now, for example, in the UK, is that the life expectancy for males is around 80, and for females is around 83. But the healthy life expectancy, i.e. the number of years that somebody can live in supposedly self-assessed good health, is still a significant gap. So for females it's around 60, for males it's around 16 years, and for females that gap is around 19 years. So there's a significant period of time there where people are not self-assessing their health as particularly good, and the role of the environment that they can play in encouraging that form of active aging. These are some of the things that have come up, and some of the questions also that have been raised around how we can enable social inclusion with older adults, and the type of things that we need to look at. And partly it is about addressing these issues of autonomy and choice and freedom as key markers of social exclusion. And it's how we can provide a range of physical, social and cultural supports for older adults to age in the community and to age well with a high quality of life. How we can challenge some of this discrimination and stigmatization that often excludes older people, and I think there are possible ways of doing that, and to enable opportunities for older adults to assume meaningful roles in the community. And part of this comes down to sort of equitability, in respect of making sure that older adults have access to services. There have been a number of different frameworks and measures of how we go about designing age-friendly communities, and a large number of these have had social inclusion as a central component of them. So the social inclusion, the notion of social inclusion is weaved into some of these. Sometimes it's given it's sort of given second-hand status, and in other ways are central to how we might measure an age-friendly community. Some of you will be familiar with these. The inclusive design for getting outdoors guidance is more specific guidance designed in the UK, focused on accessibility and other indicators. The place standard is currently being used in a Scotland context about how we can design viable places, not just to age, focus more on inclusive environments. And the wheel in the bottom right-hand corner is part of this place standard, which also has evaluation mechanisms built into them for how we can measure age friendliness. And these are some of the dimensions which, again, most of you will be familiar of in respect of the World Health Organization age-friendly city domains. And they make sense in terms of the different dimensions to us. I think sometimes the notion of social inclusion is being tagged on to issues of respect rather than being given first order priority. So that's tended to be about how we respect older adults rather than, the deeper aspects of multiple forms of social exclusion. However, you might also argue that social inclusion covers all those various different domains, and that actually it's about having opportunities for social participation, civic engagement, good quality housing and housing in the community, and transportation and other forms of information and communication. I think one of the slight weaknesses and what led us to some of this, some of the research that we're doing, is that it's tended to create these generic guidelines, these more sort of one-size-fits-all approaches to how we might go and audit our communities and our cities to check that they are age-friendly. And whilst a number of these recommendations make perfect sense, and we should be seen to be doing them, they tend to assume that these guidelines are necessarily going to fit across different cultural, social, and urban contexts, rather than understanding that actually aging might differ significantly across communities and urban areas of different size. So this is tended to assume more of a homogeneity of old age, that if we do address these, does this necessarily make our community age friendly? Well, perhaps, but in other areas, certainly we've noticed that certain groups, for example, are maybe not represented very well in these checklists, and we often aging, as a subjective experience, often isn't captured very well in checklists and guidelines for an age-friendly community. I'm going to just talk through some of the themes now that have come out of the research that we've been doing in terms of age-friendly spaces and social exclusion and social inclusion. And some of these themes are themed from the data that we've been collecting with the community. So what we've done with the research that we're doing, and we're working in 3 UK cities, Glasgow, Edinburgh, and Manchester, and 3 cities in Brazil, Pelotas, Belo Horizonte, and Brasilia. And we're comparing some of the experiences across these different cities. And within these cities, we've selected 3 neighbourhoods as well. So in essence, we've got a total of 6 cities and 18 neighbourhoods that we're working in. And we've been doing a lot of different types of methods with older adults. Some of those have been visual and creative, photo diaries with older adults, alongside things like walking interviews with older people in the communities that they're in, and also some traditional qualitative and quantitative methods, surveys and other things. And so we've tried to get an understanding of what some of these issues have been from the perspective of older adults. And some of the images I show reflect the images that older adults have taken themselves in the community. One thing that was central to a lot of older adults' experiences was the need to sort out and manage our outdoor spaces a lot better. So what we found is that it's immaterial how age-friendly a community is in respect of what services are available at the end of the road, for example. If the older adult could not navigate from home the 30 or 40 meters to the main high street, that was often a sticking point for a number of older adults. So they would find that they didn't go out because there were a number of barriers to actually doing that. They talked about the presence of lack of resting points, street furniture to rest when undertaking a journey. The presence of potholes and street maintenance, is being common. A-frames and sandwich boards that have been left in the centre of high streets and that just create barriers. And also this issue of temporary disruptions in terms of roadworks, which often go on for a considerable amount of time and can significantly disrupt people moving around the community, and again, more acutely impacts those with mobility difficulties. Some people, social participation, social inclusion was highly seasonal. So I think we talked about sort of social inclusion, but probably useful to think of it as in a more dynamic way. So people would often pass through forms of times where they felt particularly socially excluded, and often this would be seasonal with some of the older adults that we spoke to. So some just didn't go out in the winter. The lack of and the difficulties around sort of fall hazards and ice and collecting leaves and issues around there, which would be fall hazards, which prevented people going out. And some had actually had a fall, which then led to a sense of anxiety when leaving the home. And some of the images that were presented by older adults in the communities, and this is in 2 of our lower income neighbourhoods. So we sampled our neighbourhoods in the UK by income. That was one of the key indicators to see if this issue of social inclusion and social participation differed significantly by income. And we found that in some of our lower income communities, there's been a significant eroding of the local community over time. You won't be familiar with, most of you won't be familiar with the term an overspill estate. They tended to be housing developments established between the 1950s and 1960s in the UK. They were meant to be overspill estates as in connected to the city, but a lot of these are often at a certain distance away from the city, and the purpose-built housing estates. And the intention was to build what you can see in the images, which are shopping parades, into the developments as focal points for the community. Over time, in these lower income neighborhoods, these parades and these focal points have eroded, and they've received a significant lack of investment. And so for some, this notion of social inclusion was bound up within a reflection of neighborhood change and economic decline. So a number of older adults had to now travel longer distances. A lot of services have been centralized, and didn't have those immediate neighborhood supports, and often had to rely then on other people to take them around their communities. So that was very much about the sort of broader processes, I think, of neighborhood change and economic decline, and how they have impacted on local communities, and points towards the need for further urban regeneration in these communities that bring and better understand how older adults move around their local areas. These were some of the things captured by older adults when walking around their communities. So in the top left-hand corner, we have particularly issues around sort of parking and insensitivities in respect to parking. And whilst the more mobile amongst us might enable us to sort of walk around this hazard in the top left-hand corner, this van that's been parked on the sidewalk, for those with walkers, those with wheelchairs, they found these kind of things could be a real detriment to getting out into the community. Similarly, top right hand corner, the image of litter in the communities, and often this being about place aesthetics and pride in the community, and as well as being a disincentive to going out. And in the bottom left hand corner, and significant council cuts and local government cuts in the UK have led to the closure of local public toilets and washrooms, and older adults expressing dissatisfaction with this in particular, and the lack of options for them. So a lot of stories about people feeling that, oh, we can go and use the toilet in the coffee shop, but we feel like we have to buy something, or we feel that often the toilet's locked and they have to go and ask for the key at the front of the shop, and this can create sort of barriers and feelings of dependence, which they were keen to move away from. And the bottom right hand corner is a play space in Glasgow that was designed, and again, being particularly difficult for older adults to access, particularly in wheelchairs, getting down into this playground space. So it impacts on how older adults can be seen to be engaging in some of those intergenerational types of social engagement at a community level, because the urban environment often acts as a form of architectural disability. To some, not getting out of the house was enabled them to turn upon their communities in some way. So a community that was very valuable in terms of aging in place suddenly becomes a very vulnerable and isolating environment when mobility difficulties in old age make it difficult to access that environment, and people feeling a strong sense of social injustice and frustration with not being able to access the community. COPD is chronic obstructive pulmonary disease, and is a condition that traps the airwaves, which prevents many people from getting out of the house. But these conditions in old age have prevented, these chronic conditions have often prevented people from engaging in forms of social inclusion, visiting friends and other things within the local community. Transportation came up as a significant barrier to social inclusion. So not being able to get out of the house, but not being able to get to a service or a particular amenity. Loss of driving license. This is not new research. People have already identified the link between loss of driving license and the impact on independence. But to some people, the transport interventions that were there were not suitable. So often transport interventions were fine on the main arterial routes in and out of the city. They tended not to support the journeys that older adults wanted to make, which was those across communities. So they typically make shorter journeys, but they would do it across communities, and that wasn't particularly well provided for. So we had examples of older adults getting buses into the city centre to come back out to an area, a journey that would take, walking at a quick pace would only take 20 minutes. It was then taking longer because old adults had to come into the city to then come back out of the area. So there's very much this thing about the lack of a whole journey approach to transport planning, that we can get to a certain point and then we hit a sticking point, which prevents us then from getting on. It can be a different mode of transport. It can be the difficulties in getting to your destination at the other end. So these were common problems, as were things like the absence of bus shelters in the local community. So we had these two pictures taken by an older adult who, this is our lower income community, our more, what is seen as a more deprived community, for want of a better word. And it's called Bagley, and it's in the south of Manchester. And she chose to take these two images because in the left-hand image, we see a stump in the ground there, which she used as a seating, as an opportunity to sit down whilst waiting for the bus. So there wasn't adequate seating. There wasn't a bus shelter on this side of the road. And so she found when she was going to meet her friends in a community centre that she was waiting for the bus on this side, and often, if the weather was particularly bad, which it often is for those of you that know Manchester, she found that she getting on the bus here, she was often, by the time she got on, she had to shelter from the elements. And interestingly, on the other side there is a bus shelter, but it's on the return journey, so again not particularly having a beneficial impact for this participant. There were particular insensitivities shown by not only those using public transport, but those who were providing public transport. And this is an incident. Now, anybody over the age of, I think, 65 in the UK gets a free bus pass. So this situation shouldn't emerge. In essence, older adults get free bus travel. So a situation like this should never have come about. But it turned out that a lady living with quite mild form of dementia in the community got confused when she was on a bus, did not know where she was going, and assumed she had to pay even though she was in possession of a bus pass. And it particularly led to an unsavoury incident with the bus driver, and then since then she's not been on a bus. So that's how I think transport can act as a significant barrier to social inclusion. It only takes an incident like this that leads to that. Safety and security came up in a number of our communities. What was interesting about safety and security was that it was related to levels of deprivation and income, but not in the way that we thought. So what was quite surprising about what we found out was that actually those in more deprived, lower income communities had a heightened sense of safety and security than those living in the higher income communities. So often people in the higher income communities would say they felt safe, often a perception of crime more than actually being on the receiving end of actual crime. But they would say that we think, that there's by going out we'll be on the receiving end of crime. Whereas in the lower income communities, because in some communities, they had this stronger sense of social cohesion. They knew people on the street, and this led to a sense of security and safety when using public spaces. So more likely to come out into the community. It's quite surprising finding there. Housing and home again was strong, in terms of social inclusion and exclusion. When we talked about housing and home with a number of older adults, to many, home was very important for housing social relationships. So having friends and family come round in the community, and that forms a sort of passive activities that people did in the home. So often people would say, I like reading, I like knitting. In some ways passive is the wrong word, because people are engaged in these activities, but often that would be an assumption that they were isolated. So somebody would come, oh, you can't stay in your house day after day. It's important that you get out into the community. Well, some people actually did activities within the home which were actually quite rewarding. and were wrongly interpreted in that case for many as social isolation. So they'd say, well, I'm not isolated. In fact, I'm very engaged in what I'm doing. It's just that I'm doing it within the home environment. The other key issue was that people wanted to age in the community, and they wanted to age through different forms of housing support. So interestingly, people weren't against different forms of housing. In fact, people could see benefits with sheltered forms of accommodation and assisted living. And they could be beneficial in terms of social inclusion. So some of the people we interviewed in sheltered supports had the provision of communal spaces, which would bring people together, which could actually act as quite an important space for social networks to be developed. So it wasn't always the case that they didn't want these forms of housing supports. It was that they needed to be provided in the right way. And some models tended to reinforce a very institutional aspect of old age, where people would be restricted, certain restrictions around who they can bring in and when. And this attitude had then gone through to other people who said, well, you know, I don't want to live in sheltered accommodation because of these issues that I've been hearing about. And housing options within communities were generally limited. So some people, certainly in our higher income communities, they lived in quite large properties with a lot of space, and they saw the benefits of downsizing, but they didn't have any options to downsize to that would keep them in the community. So if you had to downsize, it tended to be into one bedroom accommodation, and older adults were saying, well, you know, we value our space. You know, we have, I have my grandchildren coming over. So that, you know, that was really important to a number of older adults. So it's about right sizing. It's about finding the right type of housing options for older adults, and something that we've not always got right within our communities. And people wanted to be in a community of choice. That was quite a strong element of what they said, and co-located next to transport networks where possible, and services and amenities. And again, I think the lesson there maybe for urban regeneration is how we can make sure these forms of housing are deeply integrated into, for example, the regeneration of our town centres, which can support that. Some people felt that there was difficulties in accessing services. They were often passed from pillar to post. There was a lack of continuity. You know, people saying I have to tell my story more than once if I'm trying to access health and social care services. Some people just didn't know what they were entitled to, and some people found there was, you know, often a lack of integrated, joined-up care between different sectors. And sometimes the attitude of service providers themselves could be quite patronising at a very individual level. This perception that older adults were in some way dependent on society, and that often came through in the way that they were treated by service providers. And to some, it was just the lack of basic information getting to them about what services were available, and that could be healthcare services. You know, equally it could be leisure services and other community amenities. So people still relying on word of mouth within a lot of these communities, which was effective for some if you were engaged, and again you heard through word of mouth, that was fine. But if you were housebound, it wasn't as easy to find out about what's going on in your local area. There are a number of different opportunities in neighbourhoods in respect of social participation. So a lot of communities were actually quite well provided for in terms of book clubs, dancing, gardening, but negotiating access to these services was often very difficult. So older adults said that sometimes they can be very cliquey. Other times, you know, they don't know where to go. Quite a few other people were actually put off by visiting once and then not finding it a particularly rewarding experience, and then being put off because they couldn't integrate into these settings particularly well. And there was quite a lot of negative perceptions. A lot of people saying, you know, I'm too old to do this, or I don't feel I'm able to do this, or and there's just been a lack of sort of translation a lot with older adults about the type of things, that opportunities that might be available to them. And some of these don't always have to be inclusive. In fact, some of the more significant aspects of social engagement often happened in sort of, you know, same-sex groups. You know, so I think we've got an example on the next slide of a women's group in Easterhouse, again our lower income community, but this time in Glasgow, and this community and this community that had come together, and we're all women, and all came together, and re-engaging with activities was particularly important. So people said it gave me a chance to pick up skills that I thought I had lost, as well as the social element, as well as feeling a sense of group identity. This was incredibly important to older adults, so I go there, and sometimes the activity is secondary, and it's more about the social, and it's more about, as well as those learning opportunities, it's more about how a form of group identity is nourished around these forms of social engagement. I refer to civic participation as the forms of civic engagement that might be seen as, for example, community groups, council groups, and a number of older adults were very much involved in these type of things. In fact, they often gave their time, often voluntarily, to engage in these forms of engagement. However, they weren't always rewarding for a lot of older adults. So there's still this recurring message of older adults feeling as if they're often they often go to these things, but they're not always, the comments are not always taken on board. So still very disingenuous, one-way forms of community participation, and older adults feeling that their voice was more likely to be traded off in that consultation process. So yes, they do attend these community consultation events, know that they're not particularly well responded to in terms of what happens. And a lot of older adults actually take on a huge amount of burden in old age for the community engagement stuff. And this can and did, with some older adults, lead to significant mental burnout. So people feeling as if they're taking on the problems of the community, a preoccupation that wasn't always beneficial, we didn't feel, to older adults themselves. And a quote there that nicely sums up, I think, about the fact that, that they're often heard, but they're seldom listened to. That difference between, yes, I do have my say, but no, nothing happens in terms of that. So, the lack of active listening and two-way communication as part of that consultation and engagement process. Volunteering and work, this was seen as both formal and informal, sort of formal stuff that tends to come through charity shops, but also the informal stuff in terms of people just going out and cleaning up their street, or cleaning up the community. So some of those informal groups that very rarely get recorded, and there's no particular reward for. And mostly driven by altruistic means, so people saying it's my opportunity to put something back into the community and do for others, and people found that very, very rewarding. People sometimes unsure how to volunteer and how to go about doing that. Technology was a central theme, something I've looked at previously, and older adults, in the main, there's this assumption that they wouldn't be using technology. In fact, a lot of people were using technology, and they were using it to feel better informed, finding out about stuff that's going on, finding out about health conditions. Sometimes wasn't always helpful, but also feeling socially connected as well. So people using Skype to maintain contacts, and WhatsApp as well, which was, again, quite surprising that older adults were using WhatsApp to communicate with friends who now lived at a distance. So if older adults had moved out of the community and became more spatially disconnected, technology had a real role to play in bringing those communities back together again, and still feeling socially included, despite maybe not having that face-to-face contact with people. More instruction and support needed for older adults around this process, and courses needed to reach those that are housebound. So a lot of people that were housebound, they felt that they weren't getting those supports. So those courses tended to be in libraries and other communities. Just to finish off, I mean, there were some central things around what older adults wanted. I mean, first and foremost, they talked about not wanting to live in ghettos for the old. Now, that didn't mean not living in things like sheltered housing for older people. What it meant was that the community supports in and around that housing development needed to be intergenerational. And people didn't want to be depended on, they wanted to have mutual forms of intergenerational exchange. So I can do for somebody else because I've got these skills. If that younger person can come, for example, and do my garden or do my yard or clean my yard, whatever it might be. So very much about mutual exchange rather than seeing this as, it's older adults who always want the help. So that was very important. As was the intercultural supports. So in many of our communities, there was a percentage of ethnic minority groups and different types of ethnic minority groups. Often they didn't feel that their requirements were reflected particularly well in the age-friendly agenda. So often those who were representing at community consultation meetings and telling people what they want were not always reflecting the needs of different ethnic minority groups. And often those needs and requirements were very different. So I think that's something that broadly needs to be considered more in terms of social exclusion, about how it can impact on ethnic minority groups, language and cultural barriers, amongst other things. And lastly, yeah, we sort of bringing all this back, I think, in some of our research to about rights to the city, and about how we can ensure that older adults not only have the ability to access community-based supports, but that also they're involved in that broader participation about shaping the city and about shaping urban environments, so that they feel a stronger form of urban citizenship and governance. And some of that, I think, is about challenging existing practice, working with older adults a lot more, and different groups, to make sure age, gender, and other things are strongly represented in that age-friendly community agenda, and how we better integrate that. You know, for example, there's an assumption that a lot of the interventions that are good for people over the age of 60 are good for everybody over the age of 55 or 60, and actually there are very different groups within that age group, and chronological indicators themselves are, you know, particularly poor indicators of ability and functioning. So we have people at 55 who said, you know, I can't get out of the house, I'm housebound, I've got these physical limitations. Equally, people that were 80 that were out and actively engaging in their community. So I think we need to recognise that old age has been more of a, you know, more of a fluid concept and socially constructed in many ways as well. These are just some of the methods that we used to engage with older adults in this process, and so try to put a lot of emphasis on co-dialogue and collaboration with community groups. And we're just at the stage now of the project of, so in the top left-hand corner is an area just outside of Glasgow where we did some walking interviews with people with dementia as part of another project that we were involved in. And in top right-hand corner is some of the knowledge cafe sessions, a certain methodology that brings people together with professionals as well around co-designing some of these spaces. And in the bottom left and right-hand, bottom two images are some work that we did with an affordable housing complex with Chinese older adults, and some of this centered around participatory mapping and how we can better map communities and design housing supports that support older adults. And social inclusion, you know, and I think a lot of people sort of recognize this, you know, it's not going to be solved by one sector alone, but there's a lack of integrated working at a local level. So actually, you know, people don't say, you know, it's just a transport problem for me. You know, that transport problem is often integrated with outdoor spaces and issues of health coming to it, and provision of housing, and also getting to some of these services and amenities. So it's not just about seeing these things in isolation and about working across communities. And some are doing this quite well within their policy and their plans. Age Friendly Manchester, who were particularly seen as a sort of benchmark poster child for the age friendly city agenda, has significant political buy-in, and has also connected some of these different sectoral and different levels of support. So I think that basically summarizes what I wanted to say. And I think in some ways, you know, how we can create these intergenerational spaces, I think becomes integral to social inclusion. So in some communities, this works particularly well. So we had an example of a community garden scheme that brought younger people and older people together, and led to those forms of supports from coming about. And I think in some ways it's opening up spaces within our communities. So I think people were sort of reticent about using about what a community centre meant, for example. A lot of older adults felt it meant that it was a place for older people to go for the day, rather than seeing it as an intergenerational space to bring different groups together. So younger people tended not to use these centres as much as older adults. Understanding intersectionality. So this is about age, gender. It's also about sexuality and other things in old age that might actually lead to forms of social exclusion, and how we can create models of age-friendly communities that reflect and inherently design flexibility within them, so that, you know, it's not a one-size-fits-all approach. It's about actually recognizing that there are different groups and different needs and priorities in there, and how we can make sure that we continue to engage the hardest to reach older adults in these communities, and forms of outreach and other forms of support. That brings me to the end of the presentation. So thank you for listening. I think I'll pass over to Jessica now for any questions.
Thank you, Dr. Woolrych, for your fabulous presentation. I think we have time for a few questions, so I'll just read from the ones that I've received and invite others to send in their questions as well. And just remind everyone that if we don't answer them, we try to keep them and answer them at a later date, either through the age-friendly newsletter or through other means. So please feel free to send them. Okay, the first question I have is, changes cost money, and with already strained municipal budgets, how are communities paying for successful age-friendly programs and services?
Yeah, how can they pay and what can we do? I think there's a couple of things there. There's the things that actually are costing more money now. So it's the things like, I mentioned that sort of older adults often are being passed from service to service. There's duplication of effort. They don't always work particularly efficiently. And we've not got these sectors working together, which I think will bring efficiency savings for a start. Some of the interventions that require money also have a counter argument to them. So the notion of potholes, for example, in pavements, that fixing that pothole is actually quite low cost if we look at the potential for older adults to have a fall, require post-fall care, hospital and social care admissions, etc. So I don't think this is actually finding new money. I think in many cases this is almost reorientating existing service provision and looking at the ways in which to be clever about some of these things. And again, it's that preventative agenda. But the other thing that I think that local communities can do and do very well is the opening up of sort of very low-cost supports that will enable people to come together. So often people, the role of volunteering, for example, people providing their own time. Now, I don't think we should always be relying on people to do stuff for nothing, but often they can bring these different groups together, and often older adults, and it's happening within some of these communities, it's just not very well mapped, these older adults taking on the responsibility of creating some of these social groups, which have been done with very little funding, and it's amazing what can be done with very, very little money. And to others, it was just about the orientation of a bench in a park. It was these very small scale, micro scale things that, I think need to be addressed. So yes, some of these things do require money. Where does that come from? Reorientation of some of the services, but also I think some of these are low cost, and I don't think it necessarily always means more money, but just about doing things slightly differently.
Thank you, Dr. Woolrych. I think that leads nicely into the next question that we have, which is, are there examples of how seniors can take a leadership role in helping to implement age-friendly communities?
Yeah, there are some, and I come back to the age-friendly Manchester guidance, and again, that there is probably a lot going on in different cities, but what was particularly beneficial from an age-friendly Manchester perspective was the types of older adults. First of all, they set up a citizens charter, which had a specific detail around older adults' rights in the city and in the community. And they'd also set up a number of consultation groups with older adults. So, for example, they've set up a number of cultural champions in Manchester, which have sought to engage different groups in different forms of activities in the city. And so older adults often want to assume these sort of champion roles, and often do within their communities. So a lot of that stuff is going on particularly well in Manchester. And the people that we interviewed from that older adults working group that's been set up by the city it was particularly rewarding what was happening. So they would have monthly meetings with local government about what the priorities were, and then they very much felt that those priorities then were taken up and acted upon, which often doesn't happen with these forms of things. So the cultural champions and the leadership, forms of leadership, and there are things on the Age Friendly City Manchester website about how we can, about forms of engagement with older adults to take, to assume, so they can take a leadership role in some of this.
Great. Okay, so the next question is, did anything come through in your research regarding ageist attitudes towards older adults or ageist policies?
Age-friendly attitude, the issue, sort of ageism in the context of attitudes was quite strong. And I think there's been this intergenerational tension, and I think what's happened in the UK is that's often come down to a community level. So people feeling invisible in public spaces. Somebody actually used the word invisible. I thought it was quite relevant to how they felt. And when we explored this notion of visibility, they said, well, often, people will walk past me. I don't feel recognized. Some people, as I say, would, particularly in the transport example of people who felt that there was a lack of sensitivity to the needs of older adults. And so, whilst it wasn't a direct form of discrimination in terms of ageism, you could clearly see the subtle ways in which it was coming across at a local community level. And older adults just didn't want to be seen as in need of help. So, people often resisted the fact that, people would often help to, take the shopping across the road, for example, which, we might say, well, that's a real nice thing for people to be doing. And often older adults, said, well, I want to be seen as part of the community. I want to be seen as an individual. I don't see myself as an older person. And so whilst it wasn't direct forms of ageism, there was often these subtle ways, the way that people were treated in their communities by service providers, where they were looked at with a certain level of pity, or talked down to, or talked to in a very sort of demeaning manner. And people resisted that and found that a form of sort of exclusion, without it being a sort of, some people might argue, it's not a direct form of ageism. It was coming through in those in those ways.
Okay, thank you. I think we have time for one more question. So the last question is, where do you start the generation of age-friendly communities in developing countries like Mexico?
Yeah, and this is where we are with a lot of this stuff. So, Brazil as a developing country, we've got as a partner involved in the project, and I've not presented any data from places like that. I don't know about Mexico. I would be interested to hear what the policy framework is currently in Mexico. If it's the same as other developing countries, and we've done some work in Colombia, there tends to be the lack of political buy-in for a start. So people just don't see it as a priority. There tends to be the lack of policy, so there isn't a policy framework often when you go looking for these things. And so they're at a very different trajectory to where we are in the developed world, for example, and often the requirements are very different. So in parts of our lower income communities in Brazil, they didn't have a sidewalk. They didn't have a sidewalk at all in some of these communities. And we were talking about potholes in the UK, and they're saying, well, hang on, we're just, we haven't even got a pavement, never mind potholes in the pavement. And they don't have access to basic services. So I think this sort of debate needs to happen in developing countries. The age-friendly city stuff, I don't think has had nowhere near enough attention in the developing world, and therefore we don't really know. Firstly, well, we have some evidence of how people are aging in the developing world, but we don't have the specific supports in place to address them. Now there is existing funding opportunities to work with developing countries, and one of the things that's been a real learning curve for us is to make sure that actually it's not about necessarily the Western developed world, importing their models on. From the developing world, we've learned a lot from those. So some of the favelas and the lower income communities in Brazil had strong forms of social support, and actually older adults were often assuming very meaningful roles in the community, but the physical environment itself was what we might call quite poor. So often they, even access for emergency vehicles to these communities was very difficult. So I think we need more case study research in these developing countries. I think we need to know how older adults are experiencing aging across these areas, and I think we need to shift it more to how we create models in the developing world, because, as I mentioned earlier, it is the developing world and the less developed world that are going through this rapidly aging process now. And if we have those models, and again, these are in communities, for example, Brazil, that don't have well-developed formal support networks, for example, home care, that we benefit from in the UK. So how can age-friendly models work at creating these informal opportunities at a community level in developing countries that will enable these connections and will enable these to be made? So very different, so certainly in Brazil, focused on familial supports, and therefore there's a big gap in sort of formal care supports, but that puts huge pressure on families as well in terms of providing care and support. So yeah, I think we need more understanding around how people are aging in the developing world, and models that need to be tailored to a developing world context.
Thank you, Dr. Woolrych. I think that's all the questions we have time for. That being said, I'm aware that lots of other people have asked questions, so I will figure out the best format to circulate those questions. And I also am aware that some people had asked for handouts and the recording of the webinar, which I will also circulate. So thank you, Dr. Woolrych, for the fantastic presentation and to everyone for attending. And I hope you all have an excellent day.